Something that I try to impress on patients is the nature of stones as they grow. So if someone comes in with a 5 millimeter stone, right, I classify that as kind of a moderate size, and that stone, if it tries to come out, has about a 50-50 shot of coming out. If we increase that from 5 to 10, right, so we've doubled the radius. When we double that, we're actually taking the volume, not twofold or full fourfold increase, but it's eightfold increase in volume, right? So when you go from 5 to 10, it's 8 times more stone, right? When you go from 10 to 20, right, that's another eightfold increase. So that's a 64 total fold increase between a 5 and a 20 millimeter stone. And so that's one thing I tell patients to think about. Just because a stone is sitting up in the kidney, it's not causing pain then and there. As that stone grows bigger, it's growing exponentially in volume and as well as surface area, right? So that stone growth rate typically goes faster and faster as the stone gets larger. And it may be a good idea to treat that stone before it starts to cause problems, things like causing infection, causing pain, or even causing declines in kidney function. Stones beget stones. If somebody has stones remaining in their system, it creates points or focus points where more stone crystals can kind of latch on. And because of the relationship between surface area and radius, surface area is to the second power, right? So as the stone gets bigger, it's like a snowball going downhill. That surface area gets bigger and bigger as it grows, and the stone growth rate gets faster. So my goal is always to get patients completely stone-free if possible. Once that happens, we try to optimize things like diet, like fluids, like potential medications to help prevent stones in the future. So certainly being stone-free will decrease the likelihood of forming another stone as long as everything else is also optimized. Another thing I talk about is considerations for when to treat a moderate or smaller size stone, right? So for patients who are in certain lines of work, right, long distance truck drivers, airline pilots, Antarctic explorers, right, may be a good idea to treat those stones before they try to pass, especially if they may pass at an inopportune time where patients can't get access to good medical care, right? Another consideration is if you have a really big trip coming up, you're going to be, climbing Mount Everest, right? And you have a known kidney stone, right? In the act of preparing for it, you may want to get that stone treated because the last thing you want to do is be stranded in an area, be passing a kidney stone, and be in terrible, excruciating pain.